lecture was given by a guest lecturer named Michelle Klein, and she was able to discuss her 6 startup projects, and one of them was about a wearable which would be able to predict an asthma attack. And I thought it was interesting because breathing isn't something that's monitored in hospitals, so I thought it was cool how a wearable would be able to predict that, especially something that could prevent so many deaths from happening. And also it's something that happens a lot in childcare. Additionally, I thought what was interesting is how she mentioned that one of her startups failed because they were collecting so much data and they didn't know what to do with it and how to progress marketing the product in the future. And as an informatics major, I thought it was interesting because we're taught to keep in mind users' perspective and information, and I think it's important that any device or wearable product that is collecting data should be easy and accessible for users to use, and that it needs to be useful data and pertinent to the user as well.
A topic that was discussed in lecture this week was behavioral changes and habits. As a student, it is difficult to manage our time and take care of our health positively with school, work, and extracurricular activities. A challenge in bringing change to your life is motivation, since without motivation, it is difficult to even begin changing your lifestyle, or self-discipline, where you might revert back to your old habits that you were trying to get rid of. For example, I've tried sleeping earlier than normal to increase my sleep time, but it has been difficult because I've been sleeping at the same time for many years, so I do not normally get tired at the time I wish to sleep, so I just lay in bed for a couple hours before I actually get tired. Also, I end up sleeping later because I spend time working or doing things until late at night, so it is hard to change my behavior from when I would normally want to sleep.
Hi, my name is Jaren, and this week the article is about IT technology in healthcare. So patient engagement is becoming more and more important in healthcare. The evidence demonstrates that the lack of patient engagement is a major contributor in preventable deaths. And now IT platforms are being used to increase patient engagement, improve quality of care, and provide cost-effective health services. Some of these IT platforms include short message service and online communication tools. And a study was done that concluded improvement in health behavior among different disease categories due to these IT platforms. They made a bigger impact on health outcomes and improved patient engagement.
Hi, so the second article talked about a new wearable, disposable respiratory device that can give readings on a continuous basis, and it was designed for kids who have asthma or cystic fibrosis or any other chronic pulmonary diseases. And the lead UCI researcher that developed this had a son that needed respiratory testing, but even though the son was surrounded by all these wires and machines, they couldn't give a clear data or data necessary to see what his condition is or what's wrong with him. The most interesting part about this article is how this device was created using a children's toy. And the toy, Shrinky Dinks, is essentially thin sheets of plastic that was then heated to shrink. And when it's heated and it shrinks, it's able to attach to some sort of fabric that can make it wearable. So by this toy, this essentially makes it wearable for kids and can give data just by attaching it on them, and then the data will be sent to a smartphone app. How this reading relates to this week's lecture on behavior changes, there's not a clear correlation, but I can see how when the data may give like, oh, there's an abnormality during this time, the user or the parent's user can see, oh, okay, what did we do this day? What was my children doing? And they can make those kind of behavior changes that way. But as far as like habitual changes, I don't see how it could change a children's habits unless maybe they're running too much when they shouldn't.